Welcome to the Art of the Referral podcast, where we explore the nuances of mental health referrals to better serve our patients and our communities. I'm your host, Anna O'Brien, a practicing licensed professional counselor and co-founder of Be Well Private Practice Communities and TheraVera Care Connection Technologies. I'm passionate about creating a stronger professional community that works together to reduce provider burnout, increase continuity of care, and ultimately improve the lives of people living with mental health challenges. Each week, we dive into a different specialty or supportive tool, bringing you expert interviews, practical advice, and inspiring stories to help you master the art and ethics of referrals. Join us as we navigate the complexities of patient care, enhance our professional skills, and build a more connected, health-conscious community. Let's get started. Hello and welcome back to this episode of Art of the Referral. It is titled, Death Do We Refer? Therapist Professional Wills and a Modern Solution with Dr. Robin Miller, PhD. We're so glad to have you, Robin.
Thank you. I'm so excited to be here.
Yeah. So, Robin, I understand you're a licensed clinical psychologist and you have a private practice in Bethesda, Maryland. And you've founded TheraClosure, which is the first therapist professional executor service. In nearly 25 years of clinical experience, Robin has provided training, supervision, coverage, and professional will and practice executor consultation and services, and she's written on this topic. So you can find out more about her at TheraClosure.com and email her at robin@TheraClosure.com. And we're so honored to have you here talking to us about this important topic today.
Thank you so much. I'm working really hard to try to spread the word. I know this is an issue that people, know in the back of their minds is important to think about, but we're all only human, and in the list of our priorities, thinking about and spending resources on our own mortality is, at the bottom of the list. So I appreciate the opportunity to talk about the real world impact of these issues so that therapists can really devote the attention and time that is
absolutely. I mean, you're right. It's one of those things we don't think about very often. And then every time I read about it, or it comes up in a topic with colleagues, it's kind of like, oh, whoa, this is a really important thing to consider. And what is my plan? And I think a lot of us, put it off or have a little bit of an idea of what our plan might be, but it's wonderful to talk to you and learn more about also like how you got interested in this and really how you became such an expert in this area.
Sure. Well, I had the misfortune in a sense of gaining experience as a practice executor through a couple of tragedies that occurred to close colleagues and friends. So the first time I stood up to take care of the practice of a colleague, it was when my closest psychologist friend and supervision partner of 17 years called me out of the blue and said, I'm in hospital and I have a terminal illness and I don't have long and I need you to take over. And, it's obviously terrible on so very many levels of loss and grief and tragedy for her and my experience of preparing to lose my friend. But focusing on the practical and professional consequences of that, it meant from that first moment was the point person for all of her patients in her full-time practice and figuring out what to do from there. That was my first and really most impactful experience. And I can say more about the details and the story of that. It's really eye-opening to me and very emotional and heart-wrenching, and did my best to take care of her patients and for my, to take care of my friend as she was going through this awful end of life experience, to know that, there was kind of some peace of mind in terms of entrusting her practice to my care, but really very difficult. And then second, a couple years later, I stepped in for another colleague who had a more sudden incapacitation and no warning at all, and got a call that she was medically compromised and unable to take care of her practice, and so stepped in that case kind of blindly, needing to take care of her caseload as well, and not knowing what the prognosis was or how long it was going to be that these patients needed coverage. And thankfully, she did recover, and 6 months later was able to go back to her practice, but all of the same, managing patient immediate needs and holding them through the uncertainty as they struggled with this loss, and helping them get connected with other people in the meantime, and all of those. So the two experiences together led me to write some papers. Then I started doing some trainings for clinicians, and then the reactions that I got from clinicians really led me to develop TheraClosure as a solution to how hard it is for us, understandably, to really understand what is required, not only as the therapist making the plan, to really think it through, what we need to provide, access and information, and what we want, and to clearly articulate that, but what we're asking of another to do for us, and to be sure that they understand what it is they're agreeing to do, and to be sure that there is a plan in place for realistic set of expectations on what another private practitioner who has their own full-time practice, possibly as I did, and their own family and their own personal, how they're realistically going to step in a moment of crisis, and all of a sudden take responsibility for someone else's entire practice. It's a lot. And so, like I was saying, the reactions I get from people are like, whoa, I never thought about that, or this is so overwhelming, or I don't know who to ask, and this is so stressful. And it led me to believe that as a field, we kind of have a problem where our ethics codes demand that we think about this. And of course, it makes sense clinically to want to take care of our patients, even in our absence, to have a plan for their care. But it's really hard to do. And so TheraClosure was created as a way to try and offer a much easier solution to therapists who want to do the right thing, but are so overwhelmed by how to do that they often get stuck at that point.
So, Robin, can you share a little bit about why a will and how it relates to our clinical duties and ethics and whatnot?
Sure. So across disciplines, I'm a psychologist, but in the marriage and family therapist, in the licensed professional counselors and social work, ethics codes, all of them address something about the duty of the therapist not to abandon, and in particular to plan for an untimely departure of the therapist's departure, and to plan for the well-being of the patients regarding continuity of care and confidentiality of their medical records. So in some, it's outlined a little more specifically than in others, but across the board, we all have the same duty. And so how do you do that? It's hard. It's really hard to do. So professional will is not your last will and testament. It doesn't speak to your personal assets or wishes. It is entirely related to your practice, both the clinical, especially the clinical, and also you can include some of the business elements of your practice as well, if you wish. But really, the intent is to create a guideline initially for your personal representative. Because let's say something happened to me tomorrow, my husband has no idea, how my practice works, or how to interface with clients, or what the ethical responsibilities are regarding their records. But he would be the person who, all of my assets, including my practice, fall to. And that's going to be true for everybody. So the will is for your personal representative, and it's a way of saying to them, hey, if something happens to me, what I want you to do is to connect with this colleague that I've named who will know what to do for my practice, so that you'll be spared and so my practice will be handled correctly. And here is the list of my wishes. And you document everything that you want to have happen. Like, how do you want your patients to be notified that something happened to you? What kinds of referrals do you think would be best? And are there particular people in your community or that you would want them to be referred to if they were able to take patients? And we can come back to this. The art of the referral in this circumstance is pretty challenging. But it documents then, like, who should take your medical records and what should be done with them. And how about those business aspects of your practice, like notifying past patients that the custody of their medical records has been transferred to someone else's care? In some states, that's an explicit requirement, like in Maryland, where I live. Other states don't have that as an explicit requirement, or they might have you have to put a notification in the newspaper for a 2-week period, kind of letting people, the public, know that the medical records of Robin Miller's practice have been delivered to Anna O'Brien, and so past patients of Dr. Miller can go to Dr. O'Brien or Anna O'Brien for those records, something like that, so people know if they are looking and needing that medical information, where to find it. And then there are other things that could be included in the professional will, like notify my malpractice insurance company of my death, close down my business accounts, close down my website, or put on my website and my phone that my practice is closed and they should reach out to X provider. All the details. And part of that is choosing who that practice executor is going to be. So one of the most important things to think through is, who do you trust to count on in this situation? And realistically, what are they able to promise that they will do? And will they be available to do that? Even with the very, very best intentions, your colleague who you've appointed might be on a trip or dealing with their own crisis. Who is really going to be able to step in and take on this huge responsibility in the moment of crisis? Because they're, I guess, breaking it down, the different steps to consider. The most important and most urgent thing that has to happen is your upcoming patients with appointments scheduled for tomorrow and the next day and next week. They need to be notified so that they aren't experiencing a traumatic termination, banging on your door or sitting on a Zoom, waiting, wondering, where are you, leaving messages, and you're not returning, and they are full of feelings of panic, anxiety, abandonment, loss. Where is the person I count on? So the most important thing is, who's going to find out, which patients are scheduled, how to get in touch with them, and what are they going to communicate to them? And so that needs to happen really quickly. And the other things can take a little bit longer.
Imagining it sounds like there are just so many unknown unknowns that come up sometimes. Like, oh, I didn't even consider that there would be this consideration. I know recently I had a friend who had an unexpected diagnosis that required kind of immediate surgery. And, fortunately it wasn't a end of life situation, but very similar, where, I found myself in a position of taking on the role of communicating what I needed to communicate to her clients and letting them know the plan. And I was grateful that I could still reach out if necessary, when unclear on certain questions to her. But I can't imagine how stressful that must be to find yourself in that position without much of a roadmap and wanting to do right by everyone. So thank you for bringing up these questions so we can begin to think about them more. Why do you think, though, that more therapists don't make wills, if it's clearly such an important thing to consider at any stage in our practice?
Well, I think first of all, we are only human. Just like anybody else, it's a hard thing to imagine. And so many of us live in, a healthy denial where we don't think much about what happens if I die. And most of us think, I'm young and I'm healthy and I don't need to worry about this right now. And maybe when I'm older, or maybe later in my career. And sadly, the unexpected can happen at any point. And so the the situations that I found myself taking care of were for seemingly healthy women in their 50s who you would not have imagined this was, around the corner. So I do want to communicate. It's part of good practice. It's part of practice management that I think needs to be in place from the moment any of us kind of put out a shingle. It's like getting malpractice insurance. It's like, organizing your electronic health record system so that you are compliant and fulfilling best practices for your patient's care. And I know, therapists, we go through so much training and we're so invested in continuing to do our best for our patients. And this is one blind spot that I think really we need to have the strength and the courage to face. Because, I know in my training and my style of practice, and I imagine for many of your listeners too, we pride ourselves on going deep in our own emotional capacity to explore our countertransference, to really look at our negative affect when we're angry or jealous or disgusted, and we're really, we own that and in supervision and acknowledge, and how can we use that in our best ways to inform our clinical interventions and to understand our patients when we are honest with ourselves about what we're feeling. All of these things we take such pride in being able to do. But mortality is still a no-go, even as therapists. Even we're kind of like, no, I'm not going to think about that. I'll think about anything else you want me to think about that's really hard, but not that. So we need to do better for our patients, and also then the impact that not dealing with this places not only on our patients, but then on our colleagues and especially on our families, who then are left with this big mess to deal with our practices at the same time that they are, going through a tragedy and grieving, and to protect them from that is really important.
Actually, to that point, do you have people use this service when perhaps they're ambivalent, or it's unknown if they're going to be able to return? Like, we mentioned it's professional will, not a living will. So in the sense that it doesn't necessarily mean that someone is passing away. It could be that they became incapacitated, or perhaps they're dealing with a extremely sick child, or some situation where they have a full caseload and it's just unmanageable to manage their current life stressors that they've had to take on, along with getting to everyone and providing those resources. Do you find that people use this service in ways like that as well sometimes?
So that's a tricky one. I think all of us have stressful times where we would really like to say, I can't deal with my practice right now. I need someone else to do that. And unfortunately, we don't take that on. Our responsibilities are triggered by incapacitation, primarily, first and foremost, by cognitive incapacitation. So that if you are dealing with something, whether it is physical, either because you died or because you are unconscious, or because you have, as you said, you're dealing with a tremendous tragedy like the loss of a child, or something that has made you so that you are unable to bring your competent therapist self to your interactions with your clients in person, or even in, contacting them to provide referrals. If you are unable to do that, then we would step in to do that. So if you have a broken leg, or if you're on maternity leave, or even if, you have experienced a loss and you really wish you could have some time off and want to take 2 weeks off, it's still your job as a therapist to secure your own coverage and to ask your friends to be that resource for a temporary leave of absence. But if something occurs where you are unable to do that yourself, that's when we would step in as though you are, no longer capable of taking care.
Absolutely. That makes a lot of sense. And I think, although it works on a nice spectrum, I was just imagining the exercise of going through that and really thinking about what the care or treatment plan would be for referrals for each client and how you would want to handle it and how you would want to communicate those suggestions would be so important, regardless of whether you had the capacity to do it yourself. Certainly, sometimes we might have a major stressor in our lives where we just realize, like, I'm going to have to take an extended break and I need to be able to offer referrals for those folks who don't want to wait for me. But in that moment, when you're dealing with that, trying to come up with all these referrals and options seems like a lot to manage. So even the act of kind of preparing this well seems like it would be so important, because even if you're able to implement the steps yourself, just having it takes away such a burden from the spectrum of things, of unknowns that can happen.
Absolutely. That's such a good point. And, as I walk people through this consultation and really thinking through all the steps that happen, I'm getting that kind of feedback, like, wow, this is so helpful to even think about, my practice and my patient's needs and the logistics of it, in, as you're saying, sort of a different kind of scenario where you could implement the plan on your own, but it's already laid out for you.
Absolutely. Yeah. So the traditional model versus, a little bit more of some of the services that you're offering, can you describe that, like what you see people kind of traditionally doing in the steps, and what resources are currently out there for the more kind of traditional method versus a bit more of a comprehensive approach, which you're offering?
Sure. So, what I call the traditional model is really just kind of what has happened over time since, let's say, it's been maybe 20, 25 years or so since the professional organizations have started to recommend this and to create templates. And so, since they've recommended that practitioners make this plan for the future, therapists generally look online, find a template that an organization has posted, or someone else, and adapt that to their own practice, and then ask a colleague, hey, would you do this for me? I'll do it for you. And informally kind of make a deal, and without really understanding what it's about. And I think our training, risk management training, communicates really that this is an administrative matter that you should do to cross your, to check that box that you've done it, but it doesn't really help people understand what is entailed. So the traditional model is you ask a friend, they say, okay, sure. They put you down, you put them down. People don't realize the first problem right there is if something happens to one of you, the other doesn't have coverage anymore. It's only going to work for one person, but once they're incapacitated, the other is on their own. So this partnership arrangement is a falsehood. Second, the normity of the obligation is really not typically clear to either party, so that people don't know what they're agreeing to. They think it'll take a couple hours. And, sure, who wouldn't do a couple hours worth for a friend in a terrible crisis? And let me say, I was honored to do what I did for my friends, but I know that they did not intend or understand kind of the magnitude of the burden that was handed down to me. They certainly wouldn't have wanted or intended that. And there were positives in that I felt like at a tragic time, I was doing something which helped when you're otherwise maybe feeling so passive and helpless. So there were these benefits, but the other drawbacks are sometimes practices promise in these arrangements that my estate will compensate the practice executor for their time per my hourly rate. In those circumstances, it's important to realize that what you might think is a couple hours worth of work and you're going to pay your colleague, your hourly rate for a few hours, is really many, many, many hours worth of work. So my rule of thumb is if someone has a practice where they see 20 patients a week, it's probably going to take at least 40 hours of work to help those people find referrals, to be in contact with them, to manage all of the administrative aspects of that practice. So your estate is going to get a bill 40 hours at your colleague's hourly rate. So that's a huge bill. It could be $10,000, depending on obviously where you live and the market and the going rate. So that is a major problem that people don't think through in these arrangements. Another problem is how, where I live, it's really hard to find referrals for one person. If a friend asks me, hey, can you help me find someone to see for my teenage daughter or or myself, it's really hard to find someone who has openings. But all of a sudden, here you are handed a whole caseload where you need to find 20 referrals right now, 40 referrals, depending how big the practice is. And that doesn't take into consideration, are they right gender in the right location? Do they take the right insurance? Are they, proficient in the issues at hand? It is really hard. And in my experience, I reached out to colleagues far and wide saying, I have this kind of patient that I really need a referral for. And the response I got most of the time from people is, wow, I wish I could help, but I'm full. So sorry. Even, people who I think felt so badly for me being in the position of trying to find, people have their own stuff going on. So
Absolutely.
how do you take the time to locate? And even when the therapist who's made the will themselves might leave a list of friends or colleagues, but even they are only going to be able to take at most one or two of the patients. And then you're really looking for people who can do that. And so it's a lot of work. And like we said, to do that for someone you're close to when you are grieving yourself, these aren't phone calls you can make in between your own clients when you have 10 minutes to call up some stranger and say, hey, I'm just calling to tell you your therapist died. That's not how it works. You're setting aside tremendous amounts of time. So for me, that was in the evenings after I saw my own patients to reach out and very, very thoughtfully say to people, I am the covering psychologist for X practice. And I am calling because I have some difficult news to share with you. And Dr. X really wishes she was able to tell you this news herself, but she is not able. Are you in a private place where you can speak freely for a few minutes? Dr. X has been diagnosed with and is unable to see her patients anymore. And then pausing and listening to those reactions, mostly, shock and dismay and tears and overwhelm, and being really responsive, not taking them on as as though I'm their therapist, but in a human way, really devoting time and care. And it takes a long, and then I would hang up from these calls and I would cry myself because I felt just the same as the patients that I was calling, because I had lost my closest friend. And to do that over and over and over was gut-wrenching. And also then, I wasn't sadly able to spend the time I wished I could have with my friend in her final days, because I was spending that time trying to take care of her practice, which was obviously so important to her. And I'm glad I could do that. But anyway, that's the long-winded version of how hard it is to ask a colleague to do this for you.
I think it's so important too to illustrate that. Yeah, it's just so important to illustrate the impact, and certainly you want the person to feel taken care of in that moment. On both sides, your colleague and also the folks that they care for, because that is such a huge loss when you've entrusted your emotional life and your story with someone, and to have them depart is a big deal. But knowing that they thought about you and are thinking about you even in their departure in terms of the plan, and really setting someone up with excellent referrals, is so important. And certainly if you have a caseload of 20 or 30 clients and you specialize, then, a lot of the referral types may overlap. And that's hard to find a specialist who has, spot for one client sometimes, much less 20 or 30. So I could see how it would be a lot of work and really important. One of the things that we were connecting around, to have a good sense of your colleagues in the area that have space and would be a good fit and whom you can refer to. So really fascinating stuff. And, I wanted to ask a little bit in terms of what are the things that people can kind of do on their own? I know you have some free resources available regarding will, and then some other things that maybe are a little bit tricky to do on your own that you are able to step in and support with your work at TheraClosure.
So professional wills, as this traditional model writes them, they're not contracts. They're not really legal documents. They're your wish. They're your wish that someone would step in and do this, and you've put down the person that you hope is going to do it. And certainly, hopefully, you've asked them and they've agreed, but they don't have to do anything. And maybe they won't be available to do what even they may have agreed to do. So it's important to know you can find a template on the internet, and I have provided one that I think is as comprehensive as possible in a generic way, that's pulled in all the different pieces of what people should think about. And you can use that, and you can talk to a colleague and name them. However, it is not a legal document unless both people sign it. If both people sign it, then it's a contract, and then it would be enforceable in the sense that the person has an obligation to do what they are agreeing to do for you. But that creates liability for them that they may or may not want to take on. And so you can consult an attorney to review, to make sure what you've set out in that will is legally appropriate, makes sense, is consistent with your state laws as well as with your personal will and testament. However, you will likely pay between $1,500 and $3,000 for an attorney to help you make a will. And then that's all you have. You have the will. You have this piece of paper that you can waive, but you have no services provided with the attorney's help in making that will. So TheraClosure attempts to address all of these problems. I have come to believe that it is not in anybody's best interest for a close friend or colleague to be the point person here, to be the practice executive. It's just too gut-wrenching, and then you don't have the mental capacity really to make decisions in the best interests of the patients. Of course, I did the best I could, and I think I did a pretty good job, but obviously so taxing.
You're processing your own stuff.
Clearer head, yes, might have handled it differently. So I've come to believe that if you want to do this yourself, my recommendation is that it's not one person, that it would be a group of colleagues, none of whom you are especially close to, but a group that you could trust that will come together to together divide the responsibilities of this task, and to create a will where they sign it, and everybody as part of a group signs that together. There are some pitfalls in that it's a diffusion of responsibility. And so it may be that any one person doesn't have the full picture, that people might fall through the cracks, that someone thinks someone else is handling something. There can be problems with that, but it's a better plan than choosing one person, and especially one person that you're close to. TheraClosure is my attempt to, again, solve all these problems. So of course you want a clinician to do this. A lawyer might tell you it's an administrative job. It could be someone who's not a clinician. Most of our ethics codes say that it needs to be a qualified individual. And what that means might vary, but my opinion in dealing with these bereft people in crisis is that it should be a clinician who can speak with them appropriately and also understands the rules and regulations regarding confidentiality and is able to
Absolutely.
make those referrals and all of those things. So to name a colleague, a clinician, you also want to feel, I understand, you want to feel as that therapist that someone who kind of understands what you're about as a therapist and is going to care about your patients and your practice. You want to trust that, but that doesn't have to be your best friend, because again, not only is it a huge burden for your best friend who will be grieving, but also your patients don't know that that's your best friend. You think it's going to be better somehow if someone who really knows you intimately makes those calls, but it's not really in their patient's best interest. So what TheraClosure tries to do is we want to get to know you, your practice, what kind of patients you see, what your style is, how you relate to them. We really want to know so that we can provide the services as a good friend would want to provide for you, but without that emotional entanglement of being overwhelmed by that personal relationship and the loss of that at the time. So we get to know you. We put in a plan that makes sense with your input on how we would get access to your records, whether that's through an EHR or through, if you have paper records, what our plan would be to get that information and patient contact information and your schedule. We gather a whole bunch of details about how we are going to fulfill exactly your instructions on referrals, on how to notify, on custody of the records, and so forth. We create a professional will that names TheraClosure as the practice executor, and we have clinicians, only clinicians, who will be the ones who would step up in this case to reach out to the patients. And
Absolutely.
we sign a will, and you review it and make sure. And then we are on retainer for you in case of an incident, an incapacitation or death. And then we will, if called into service, perform all of those services with no additional cost to your practice. So the other benefit, even though it's signing up for a yearly subscription fee to have us on retainer for you, in the end, it's a controlled cost where you know per year what you're going to be spending, and you know that your estate is never going to be saddled with a huge unexpected bill. There will be no further costs.
Yeah, that's one of the things that really stood out to me as you were talking. I think we do this work because we care, and certainly if you're in private practice, you may be able to kind of have a income that supports your lifestyle. A lot of us struggle with that even in this field. It's hard with reimbursement rates sometimes. It's challenging to pick things to spend money for, in terms of, do I really need this in my practice? One of the things that stood out to me as you were talking is that it's an expense no matter what, right? If you're practicing up until the end of your life, and we don't really have control over, when the end of our lives are, it is a risk that it is an expense either way. And so to know and plan for something, as opposed to, I was just doing the math in my head, like if you charge $150 a session, if you don't have a plan in place and someone is, spending, even if you have 10 clients, that can be $3,000 off of your estate, and much more the higher you go up. So that really made a lot of sense to me as you were talking.
Sorry, let me add one other thing, which is the potential for liability. Not only the unexpected cost for your executor, but if this isn't handled properly, your estate is left open to lawsuit around confidentiality. Sometimes I hear from people, I have 40 boxes of patient records going back, 25 years in my basement. And what do I
Right.
do with that? If you don't have a will in place and your family comes in with the very best of intentions, but they don't understand the rules around confidentiality, they can put that on the curb. And then, you
Gosh,
can be sued for breach of confidentiality, for mishandling of
yikes.
medical records. There's
Right.
so many different
Yeah.
circumstances that could happen.
Certainly not the things we want as a legacy to like a really excellent career, right? And even as you said that, I remember reading some emails from an online therapy platform where they just emailed a client and said, we're sorry to inform you that your therapist has passed away. And just like the horror I remember feeling reading that, it made me think a lot. I wanted to do a little plug for this, that like, if you are not in private practice and are instead working for a company, it really, after talking to you, it made me want to like offer the advice to everyone that one of your interview back to them questions as you're getting hired is, how do you plan for, in the event of an untimely death or, having to leave practice? How do you take care of your providers and the clients that they see? Because that seems like it could tell you a lot about a culture of a company.
Yeah, excellent point. Excellent idea, because nobody wants your patient that you've worked with for a long time who really trusts you to get a corporate email. We make a point of all these communications with current patients are only by phone, as long as we can get in touch with someone after repeated tries. And we are going to follow up, and we are going to have multiple lengthy conversations with them, because of course some people are going to say, oh my gosh, I'm so overwhelmed. I don't want to talk about referrals right now. I'm sorry, and they're going to say, of course, I understand. Is it okay if I call you back next week? And you want to really be a transitional object, kind of saying, in the meantime, while you're dealing with this traumatic loss, I'm going to shepherd you through. And like you had mentioned earlier, which is such an important point that I want to reiterate, it communicates my therapist really cared about me. My therapist put this plan in place. And that's part of our goal in contacting patients, is to communicate, your therapist really thought deeply about the
Absolutely.
services.
That gave me chills when you said it. Yeah, I mean, that's like, right, we're that object for people to really feel seen and heard. And even in our absence, that we like live on in their mind as that symbol. Thank you so much for your time, Robin. This is so important. And, I'm going to be linking to TheraClosure in the notes. You mentioned that you have some free resources as well as information about the services you offer there. And also a plug for Consult List here. It's a free service to join. And our goal is to really help arm you with a tool that can connect you when you need to make clinical referrals to providers within your community. You get to pick who you refer to and learn more about their services and cultivate a list. And we're hoping that this can be really supportive also to people when they're trying to make referrals in the event that they become incapacitated. So please feel free to utilize, again, free, no catches, free for all licensed providers to sign up and enjoy. And we're excited to, hopefully collaborate with you in the future, Robin, because the work you're doing is so important. And I'm so fortunate that I ran across you through LinkedIn and got to know you better.
Well, thank you so much. And I am excited as well to know about contact lists, because we are always looking for really good networks of therapists in all locations who are vetted and reachable, and we're able to know their practice interests and availability. So we are so grateful to you as well. And thank you so much for having me.
Absolutely. All right. Well, thanks again, Robin. And again, if you need to find any more information out about Robin's services and her company, TheraClosure, you can go to TheraClosure.com. And Robin, your email address is robin with a Y at TheraClosure.com. Is that correct?
That's absolutely right. And we do offer a free 20-minute informational meeting to help folks determine if we can be of help.
Wonderful.
Great.
Yeah. All right. Thanks, Robin. Have a wonderful day.
Thank you. You too.
Thank you for tuning in to the Art of the Referral podcast. We hope you found today's episode insightful and valuable. Don't forget to subscribe and leave a review to help us reach more providers and clinicians like you. Follow us on social media and visit our website for additional resources and updates on upcoming episodes. Until next time, keep mastering the art of referrals and making a difference in patient care. Goodbye.